Our last session this a great day today is entitled Los Angeles County Tobacco Control and Prevention Program Activities and Community Resources for Smoking Cessation. The speakers are Jasmine Guillen and Jonathan Tandup. And thanks everybody for staying.
Thank you, Dr. Freeman. Can everyone see me? I'm short, so I wore my extra high heels today. And if you haven't heard me, thank you for everyone who stayed this late. I promise to get you guys out of here soon so you guys can start your weekend. Again, my name is Jasmine Guillen. I am the project manager for the cessation unit at the LA County Department of Public Health Tobacco Control and Prevention Program. Behind me is my colleague, Jonathan Tandup, and we'll be talking about a little bit of what we do as a program, as a department, Tobacco Control and Prevention Program, and then what we do as a unit, our cessation and clinical intervention unit. I'm going to be going over a little bit what Dr. Friedman talked about this morning, the Los Angeles County smoking prevalence rates, again, what we're doing in Los Angeles County, our priority areas, our priority areas for the department, our cessation and clinical intervention unit, our health agency resource list, and then John will go over our LA Clips website. As you guys know, smoking is the #1 preventable cause of death. It causes more deaths each year than HIV, illegal drug use, alcohol use, motor vehicle accidents, and firearm accidents combined. So I think that's why we're all here today, because there's a strong importance for the work that we're all doing in tobacco cessation. Again, kind of to reiterate what Dr. Friedman said this morning, our goal by 2020 is to reach that 12% mark. As you can see, these are all the spas in LA County, and I think it's only spa 5 that's below that mark. And no, just spa 5. So it's our job to increase tobacco cessation interventions in all these spas, and that's what our unit at the county is working towards. And again, smoking prevalence rates are highest among minority populations, including our Latinos and African American men. With the less educated, high school diploma or less. And then with the federal poverty level, I think I just read right now, 100% federal poverty level is about a single person who makes about $12,000 a year in 2019. And you can see the second bar goes up to 200%, which is about someone who makes about $25,000 a year. So those two combined have the highest smoking prevalence rate. So we have the low income, the less educated, and then our minority populations. As a recap, there's just under 1 million adults who continue to smoke in Los Angeles County. 1 out of 7 deaths is caused by cigarette smoking. Smoking costs more than $4.3 billion with the P dollars per year, and more than 500,000 non-smoking adults and children are currently being exposed to secondhand smoke. And smoking is related to the top 5 causes of death. Does anyone remember Prop 99? If you don't read any of these boards, does anyone remember Prop 99, 1988? I was kind of a baby back then. So Prop 99, which passed in 1988, gave the tobacco tax, the 25-cent tobacco tax on cigarettes. So that was about 31 years ago now. With that money, the first statewide tobacco control program was established, known as the California Tobacco Control Program, or CTCP. CTCP then funded, with that same 25 cents per pack, 61 local public health departments, including Los Angeles. Does anyone remember Prop 56, or even know about Prop 56 that passed 2 years ago? Prop 56, anyone heard about it? Prop 56 was another tax. So it took them almost 30 years to pass a $2 tax, right? So 2 years ago, 30 years ago, there was Prop 99, which is a 25-cent tax. 2 years ago, there was Prop 56, which added a $2 tax. So all of our interventions, all of our work that we're doing comes from that $2 tax. So the people who are basically paying for our intervention work are the people who smoke, who we're trying to help. So almost like keep smoking so we can get money. I'm just kidding. Just kidding. So the Department of Public Health, our Tobacco Control and Prevention Program, also known as TCPP, our aim is to lower tobacco-related death, disease, and disability in Los Angeles County. Through that, we're trying to do that through our social norm change, and we're trying to create a social and legal climate where tobacco is less desirable, less acceptable, and less accessible, especially to our youth. So our activities that we do is public policy, and what we're doing right now is we have 21 subcontractors, and this is from the Prop 56 money. 10 of them are working in multi-unit housing, trying to pass smoke-free multi-unit housing. 9 of them are working in outdoor areas, which include outdoor dining, so any restaurant that has a patio for people who smoke. Service areas like the food truck lines, ATM lines, bus stops. And tobacco retail licensing. We have 9 subcontractors working in tobacco retail licensing and zoning, which means we're trying to get the tobacco retailers out of reach of schools, and also to find those who are consistently selling to minors, selling to our youth. We also have subcontractors working to strengthen existing policies. I worked in a policy a couple years ago in the city of Culver City to regulate secondhand smoke and multi-unit housing. So now we have subcontractors going back to speak louder. Oh yay, anyway, you have some policy people here. Okay, so we have subcontractors going back. Before the definition of smoking only included cigarettes, traditional cigarettes or conventional cigarettes. So now we have some contractors going back to include marijuana and electronic cigarettes and vaping in those definitions. So currently in LA County, wherever smoking is prohibited, if they don't already have marijuana and e-cigs in the definitions, they're going to add that soon. That's what we're working towards with our subcontractors. We also have educational media campaigns. We have some billboards, some bus stop signs with our LA Quits information. We're working with health facilities, behavioral health agencies, public health centers, and businesses, all to become smoke-free. And then our team, John and I, are cessation, education, and resources. So our priority area, kind of what I touched on, is to reduce youth access to tobacco products. That's our folks working in TRL, tobacco retail licensing and zoning, and to prevent kids from smoking altogether. We also have a menthol and flavored cigarette ban that's going on, or we're working on in, I think, LA City as well as LA County. And then we have MUH, multi-unit housing, falls under our policy to reduce exposure to secondhand smoke. And under that, it's outdoor areas and multi-unit housing. And then we also have our healthcare systems transformation project we're working on, and we're collaborating with TRDRP and Dr. Freeman Hurley to do that work. So here comes our work. So John and I are part of a new unit. So TCPP, Tobacco Control Prevention, has been doing policy work for the past 20 years, pretty much ever since Prop 99, so 30 years. So they did cessation about 10 years ago. It wasn't a really big hit. Everyone wanted to focus on passing policy, telling people where they can and cannot smoke, but no one really did a lot around helping those who wanted to quit smoking. Or, you tell someone they can't smoke in their home or they can't smoke at a park or a beach anymore, but no one said, they just said, stop smoking. They never said, well, let me show you how to quit smoking. So that's really our goal. Our goal for the cessation unit is to increase tobacco screening through all of our health agency clinics. We also have a work group that meets every month. Our next work group meeting is August 8th over at our office at the Metroplex on Wilshire and Normandy. And we convene once a month, and we sit with tobacco control and cessation programs. We discuss challenges and barriers. I have a couple ladies who are in my work group who are here today, so I'm excited to see you girls. We welcome more people. We're also trying to build a network of community cessation programs. So we don't know what everyone's doing out there, and we want to know, and we want to build a network so we can share it with people. Because we have people calling our office saying, "Here, I want to quit smoking. Do you have free patches? Do you have medication? Do you have programs I can go to?" And so you want to be able to share that with the community. You want to go over this?
I'll go over this.
Does anyone have any questions? Mm-hmm. 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 So I was trained a couple years ago through UCLA, with UCLA and American Lung Association called Freedom from Smoking. They have a great curriculum that I used to use in my health groups. I think we're trying out the Kick Ash, but we're not ready to share that yet. Is that correct?
No, but the Kick Ash is nothing new. It didn't come from the top of my head.
Mm-hmm.
So it's from research from other curriculums like Freedom from Smoking.
Mm-hmm.
There are the mentions by the University of Colorado that I pulled from. That one is not a free one, but there is a free one. There are a lot of free ones online, and I have multiple that I. Thank you.
Mm-hmm. It's through American Lung Association, but I was partnering with UCLA at the time. It's called Freedom from Smoking. Yeah, you have to pay for that one? I had to pay for it. Yeah, I had to pay for it.
Well, then don't quote me.
Yeah. But I will give you guys my business cards and we'll send you some links to the gotcha questions.
I wanted to ask about public housing or multi-unit housing.
Mm-hmm.
Could you kind of, you already, well, she asked me the question, I could just go to ask.
Oh.
Yeah, so, you know, I clients in Section 8 housing, their neighbor smokes.
Mm-hmm.
And what recourse an individual like that have if they're exposed to secondhand smoking and to asthma and allergies and concerns?
So if they contact, we have a hotline actually over at the Tobacco Control Prevention Program. I don't actually know the number off the top of my head, but I can get it to you. And if they call LA County Tobacco Control Program, we can contact whoever that landlord is and send them a letter with our letterhead on it and saying that, you know, they need to take action, that we're already aware of it, and then just take further steps from there. We said this could be an offline conversation because I can go on forever about it, but if they haven't already tried to mitigate the situation, maybe with their landlord or whoever, I'm not sure. But what they can do is they can call our office. We will send a certified letter to whoever their landlord is, or the property management company. So it just depends on if they're in, rent control or not. If they're rent controlled, it's limited. If they're not, again, it's all property management. And but again, we can have an offline conversation about it. Mm-hmm. Any more questions?
Really quick.
Mm-hmm.
Kind of wanted to clarify your,
Yes. Mm-hmm.
now, what is that person
A single-family homeowner. So this is only unless they're condos, right? So there's condominiums, which are considered kind of multi-unit housing depending on how they're structured, and there's single-family homeowners. We don't do anything with single-family homeowners. If they live in condos or townhouses and they own them, in Culver City, when we passed the smoke-free multi-unit housing in Culver City, we included condos. Some cities don't even touch condos. It's too hard because people own it, even though they share walls, ventilation systems. Some city councils don't touch it. So it just depends on what the city, what the rules are in there. Mm-hmm.
Hi, have you guys done social outreach to social organizations as well about cessation of smoking, like African American organizations, Latino organizations, LGBT organizations as well?
So we have a part of our tobacco control program, we're the cessation unit. We have a community engagement unit that works on bringing all of those social organizations to our quarterly coalition meeting. And we go in there and we talk to them about our work group, and if anyone wants information, we give it to them. But we have a lot of groups that are part of our LA County Smoke-Free Coalition, Tobacco-Free Coalition. Any other questions? Awesome.
Okay. Hello, guys. Okay, my name is John Tandock. I'm the Assistant Program Analyst with the tobacco team under cessation. So one of the parts I did also was, I'm new, but resources was my thing. You know, we try to figure out, I was looking through systems, of course, with the guide of Jasmine and our whole team to figure out what's out there that I could use for me and also help out our partners that are out there. 1-800-NO-BUT is one of the best websites that we use for resources. Our resource that we use because a lot of it's free. You go in there and just download it. It's kind of hard to navigate, but what we did as a team, we created some packets that helps out with clinical base and also just for the community. But one of the best websites to get resources. And if there's nothing out there you can't find, we're willing to help look for that, put that together for you guys. Some of the resources that we put together, and I mentioned the tobacco cessation packet. This helps out again with a lot of tobacco related issues are all in one packet to give out to the community and also to help out with clinicians that are starting to ask, advise, refer as far as a resource goes. LA Quits, and I'll go over that. I'll go over that after because I think we have the website right next. The community resource list, I think in your folders, if you guys look, there's a stapled document. Those are resources that we put together not only to help with tobacco, but to also help out with other related health issues. It goes, there's information about mental health, alcohol abuse, and it's a thing that we also, as a cessation team, that we always provide. Again, I give you guys my information. We could also email that to you too, because there are live links and it's easier to get to. So how do we get over here? You able to pull it up?
Oh, here it is. Can you see that?
Yeah, I can see it. Cool. Okay, so here's so this website, LA Quits, was actually also a website that was funded through TCPP, and it was done by our what was that team again? Communication team. Sorry. So what we did is we got a group of people, including some of the TCPP staff, to create this website. I'll go through a couple of things right here. Stress, and what we did was we figured out. It's not going. Sorry. Okay, here you go. So what this website was meant for patients, clients, or that quit to stay quit and not start. A lot of advice on here for urges that to help. So I'll play some of the videos that we have on here. Oh, it happens to be.
Being active sends out natural chemicals that help your mood or reduce your stress. Sometimes a short walk is all it takes.
So again, throughout the website, again, videos on tips on stress, ready to quit, planning, just quit, and also another use also just for loved ones. Loved ones could get on this page and find information to help loved ones either stay quit or start quitting tobacco. Okay, and the popular demand by this is a fidget spinner, other than a cigarette. The star is a fidget spinner in this guy, okay?
Activities that keep your hands busy, like squeezing a stress ball or playing with a fidget spinner.
And the fidget spinner had a lot of contract issues with that one. Was there more with the presentation? That was it.
Yeah, and just to add, LEQIP's website, we also have information on vaping, and marijuana, and also on healthy homes. Excuse me. And it's really just to, be for the community. We also had sent some of these YouTube video links to some of our work group members who work in clinics, and they have these videos all in the loop. So as you're waiting in the lobby, whether you smoke or not, you can just, watch these videos, and they're all quit tips on how to quit or on how to stay quit.
Yeah, and also, so as far as resources goes, we put together a lot as a team that helped us get through our trainings that we help, and anything that we can help you guys with, please let us know.
Where are the funding grants? Where do we look for something like that? For smoking cessation?
I'm sorry, can you repeat your question?
Where will we look for the funding grants for smoking cessation? If there are any out there.
The only thing we have so what we're trying to do is build a network of everyone in the community, of all the resources in the community that relate to cessation. Besides Dr. Friedman, Dr. Hurley's group, that study that's going on. I know, actually, I think John's going to talk about some of the resources. There was a request for an application that just came out. I think it's due at the end of this month, but it's for behavioral health settings to focus on. Well, you can pick smoking cessation as one of them. But again, we can give you that information at the end if you're interested. Mm-hmm.
Okay, so here are some of the health agency resource lists that you also can find on the California QIPS website as well. So American Lung, and you also have Watch Healthcare, City of Hope, and again, all our information is on there. So again, a lot of these resource lists, this health agency resource list, you also can find again with more information. There's our information. We could go provide you guys with more info if you guys need.
And just to add before we finish, is we're also collaborating with California Smokers Helpline, California QIPS, and we're providing trainings on nicotine addiction, Ask Advisor so we can get people to start implementing just tobacco screenings in their everyday workflow. So if you guys have any questions, if you guys need to go out and talk maybe to your staff, to your patients or clients, participants, whoever it may be, we're available. We have a lot of great information, educational materials, and we're saving it specifically for our cessation folks, those who are doing cessation work. Again, tobacco control and prevention program has a lot of things going on. They have policy, they have media and educational campaigns, and then there's Little Old Cessation. That's a small group of us, and we're really just trying to expand out into the county. And we have a lot of great resources and, again, materials that we would love to share with everyone. So take down our information, give us a call, and we're happy to share it. Are there any questions before I sign off? No? Thank you, guys.
Thank you.
Great job, right? Arma's coming up.
Well, we're wrapping it up. I think we all got a lot of information to try to sift through and go back and see what of this we can use and how we can apply it and what are next steps. And just really thankful that you could all make it today. Just a reminder that whether or not you requested CEUs, you will be getting a certificate of participation, because I know in some of the substance abuse programs, the administrative staff even, they need to have some units of service. So that and...
So hand in your evaluations.
Oh, yes.
Out there.
The yellow evaluation, and then those getting CEUs have something else that they need to hand in. Very soon, we hope to be starting to accept clients into the study. So you'll be hearing more about that. It'll be coming. And we have all of your email addresses, so if pertinent things come up, we'll be able to shoot an email out.
The slides and the talks will be posted both on the Dropbox site that you got and on the Charles Drew website, and we'll send out a reminder for that once it's up.
And
I want to give Norma Batume a big hand.
the conference you organized. I think you did a fantastic job.
It was really good. If anybody else that wants to personally wish Norma congratulations, sure
Oh.
she appreciate it. But thanks everybody for coming.
Thank you for coming. Oh.
Sorry.